Someone said a patient pulled out your wig and you were laughing. You were supposed to correct her and let her know that it is wrong. Well, in nursing, things are different. If a fully oriented patient pulled out my wig or is being verbally abusive, we have to correct them and let them know it is unacceptable. You are taking care of them, and so being verbally abusive is not acceptable. But this is a dementia patient. In dementia patients, we meet them where they are. If, for instance, a dementia patient says, "Oh, I am going on a second date with my boyfriend who was their husband of 60 years and is now dead," you don't tell your patient, "Oh, Jack is now dead, go back to bed." No, it doesn't work, because you are going to escalate the situation and you make the patient grieve all over again, and they are going to be anxious and it's going to cause a lot of chaos. So you don't do that. If a patient says, "Oh, I need to go home because my son is going to be late for school," you don't say, "Oh, you don't have a baby, your son is now 50 years old." No, you say, "Oh, I am going to make sure that your son gets to school. We will make arrangements, or I will make a call and make sure that your kids or your baby gets to school." Different scenario with different intervention. There's a place for therapeutic redirection and there's a place to set boundaries. If a patient is fully oriented, you set boundaries. But if a patient is not fully oriented, setting boundary is a waste of time, especially in dementia patients. In dementia patients, we meet them where they are. We find a place to redirect them and be like, "Oh, tell me about your first date. Tell me about this person." That must be fun. You want to engage them and they are excited, they want to talk to you. Then you can say, "Oh, let's play a game." And then they forget that they were getting ready to go on a date. That's the way to de escalate if a dementia patient is getting anxious. But if a fully oriented patient, maybe psych, or maybe a patient that is just throwing tantrum, in tantrum behavior, if a patient is acting out, you can set boundaries because they are fully oriented. You let them know, "I understand you are upset, but throwing objects or touching a nurse is unacceptable." You let them know, you set a very firm boundary. And if they are still acting out, you can call a code on them. But a dementia patient is not fully oriented. They do not know what they are doing. So you meet them where they are. So, no, I am not going to waste my time to explain to the patient why they shouldn't take off my wig. If at that point taking off my wig is the problem and she did it, she felt fulfilled, she was happy, so be it. That's okay. The next time she's the sweetest person, he says, "Oh, thank you, please, and thank you." It's okay. That's where they are at that point.